What you should know about diabetes symptoms. Let's contrast the early signs of diabetes and see how they differ between type 1 and type 2, men and women, toddlers and adults, and males and females. When your body is unable to control your blood sugar levels, you develop diabetes. Diabetes symptoms can result from having a high blood sugar level, heightened thirst, excessive urination, increased appetite, unaccounted for weight loss, hazy vision. Both type 1 and type 2 diabetes share the same symptoms. The types, however, grow at quite different rates. The symptoms that result from this manifest extremely differently. Early indications. High blood sugar levels in the body cause diabetes symptoms. When type 1 diabetes is present, these symptoms appear suddenly. Over many years, type 2 diabetes frequently develops slowly. Typical early signs include heightened thirst, increased appetite, fatigue, hazy vision, frequent urination that keeps you up at night, irritability, mood shifts, sudden weight loss, cuts, sores, and bruising that take a while to heal. Signs of type 1. As the body's pancreas quits generating insulin, type 1 diabetes symptoms appear fairly quickly, frequently over a few weeks. Type 1 diabetes typically manifests in infancy or adolescence, however it can also appear in adults. Since type 1 diabetes symptoms manifest so suddenly, they are frequently severe and obvious. You might, for instance, lose a significant amount of weight in a few weeks. Additionally, nausea and stomach ache are possible. Furthermore, because type 1 diabetes progresses quickly, your blood sugar levels may rise significantly before you receive a diagnosis and begin treatment. This can occasionally result in a medical emergency called ketoacidosis that needs to be treated right once. Signs of type 2. Due to insulin resistance and the pancreas gradually losing its capacity to produce enough insulin, type 2 diabetes symptoms appear later than type 1 diabetes symptoms. Type 2 diabetes can go years without showing any signs of it. When symptoms do appear, they are frequently not severe. It's simple to brush them off or mistake them for other illnesses. People with type 2 diabetes gradually experience rising blood glucose levels, which can lead to skin variations, seeing less, foot ulcers. Urgent attention is required for limb discomfort and numbness. General diabetes symptoms. Diabetes symptoms, particularly in the beginning, may appear to be unimportant. The most prevalent signs of diabetes, such as excessive thirst and exhaustion, are frequently nebulous and can resemble minor inconveniences. In order to be checked for diabetes, you should go to your doctor if you have one or more of the following symptoms: increased appetite, heightened thirst, slim down, excessive urination, hazy vision, observable exhaustion, wounds that never mend, decreased libido, erection problems, candida infections, infections of the urinary tract. Consult a doctor if you have any concerns about diabetes and discuss any symptoms you may be having. Diabetes symptoms that go untreated. Even if your diabetes symptoms are mild, it's still crucial to get treatment. Diabetes that is not treated can be highly harmful. Discuss the best course of action with your doctor, as well as any warning signs of untreated diabetes that you should be aware of. Diabetes that is not managed can result in a number of problems, such as foot problems, nerve injury, compromised blood vessels, urine containing protein, issues with the pancreas's operation, renal problems, a lot of urinating, gastroparesis causes nausea and heartburn, heightened potential for heart illness, greater potential for infection, glaucoma and cataracts, increased stroke risk. Just how is diabetes identified? One or more tests may be administered by your doctor to check for diabetes. The most used test is the glycated hemoglobin, A1C, test. This blood test reveals your typical blood sugar level during the last 2 to 3 months. It counts how much blood sugar is bonded to hemoglobin. Hemoglobin binds to sugar more strongly the higher your blood sugar levels are. Your doctor will diagnose diabetes if you have an A1C score of 6.5% or greater on 2 different tests. If your A1C level is between 5.7 and 6.4, your doctor will diagnose prediabetes. A1C levels below 5.7 are regarded as being normal. Your doctor will go on to more testing alternatives if these results are inconsistent. The following circumstances can result in erroneous results. Anemia. Unusual forms of hemoglobin. Long-term kidney disease. Additional test choices consist of random test for blood sugar. A random time will be chosen by your doctor to draw blood. You probably have diabetes if your blood sugar levels are 200 mg per deciliter, mg/dl, or above. Blood sugar test after fasting. After a time of fasting, your doctor will draw blood for analysis. Diagnosis of diabetes is made if your blood sugar levels are 126 mg/dl or greater. On a different day, you should get these readings verified. An oral glucose tolerance test may also be advised by your doctor. Your doctor will ask you to take a fasting blood sugar test prior to an oral glucose tolerance test. They will then give you a sweet beverage to drink, and during the next 2 hours, they will periodically check your blood sugar levels. If this is greater than 200 mg/dl, diabetes will be identified as your condition. Consult your doctor to learn which screening technique is best for you as well as what you can do to get ready. Takeaway. Sometimes, especially in the beginning stages, diabetes symptoms may not be immediately apparent. Knowing the symptoms might help you decide whether to see a doctor, especially if the symptoms persist or worsen. It's a good idea to seek an assessment of your symptoms as soon as you can so that you can begin treatment, if required. You'll feel better and the potential harm to your body will be lessened. If you are told you have diabetes, your doctor will probably put you in touch with a dietitian and diabetes educator. They can collaborate with you to create a diabetes control strategy tailored to your particular requirements. Your management strategy will combine dietary recommendations, an exercise routine, and medications made to control your blood sugar levels. Additionally, your doctor could advise routine blood sugar checks. To find a therapy strategy that is most effective for you, some trial and error may be necessary.